In the 1980s, people started mixing chemotherapy drugs with the stuff we inject to clog up the arteries, and so now you're cutting off the blood flow of the tumors and simultaneously depositing super concentrated chemo drugs directly in the tumors themselves, where they get stuck for weeks. So now you're killing the tumor two different ways, and that's a procedure called chemoembolization. So chemoembolization's been done all over the world for the last 30 years. We do at least 2 or 3 every day at my hospital. So that technique's been around for a long time. A more recent development is trying to find ways to kind of deliver the drug better to the tumor and keep it in the tumor. So in the old-fashioned way, what we call classical chemoembolization, we just have a mixture of an emulsion of drugs mixed up with some X-ray dye that we inject into the tumors, and then we add some particles at the end to stop the flow. But there's some newer techniques where you can take little microscopic particles and you can actually load the drug on the spheres or on the beads. And then we inject those, they all get stuck in the tumor, and then the drug slowly gets released. So you kind of get better drug retention for a longer period of time in the liver when you do it that way. So we have now what's called DEBs, or drug-eluting bead chemoembolization.